Today we're going to be talking about the next steps as we age. So what does that look like? Understanding what perimenopause and menopause actually mean, knowing when you need to go see your OB-GYN for a concern or a problem. So I want you guys to understand what's normal as we age and what's not normal. So what exactly is perimenopause and what is menopause? So as we get into perimenopause, we start to see changes in our hormones. Our estrogen levels go all over the place, progesterone levels go all over the place. This causes changes in what our periods do, and then we get other symptoms that we are familiar with, such as hot flashes, mood changes, sleep changes, weight changes. Everything can feel a little out of sorts. This can start anywhere from 3 to 10 years before menopause. People think, oh, I don't have to worry about that until I'm 50. But if you're someone who goes through menopause at age 45, you may start having symptoms as early as mid-30s. And it is still possible to get pregnant during this time until you stop having periods. And that's the true medical definition of menopause, is an entire year without having your period. This is when your ovaries stop making your estrogen, and this is the end of the reproductive years. The average age of this in the United States is age 51, but it can vary. Even before 45 is normal. And this is what those hormones look like. Some people say, can I just check my hormones to see if I'm in perimenopause? We usually don't recommend checking your hormones to tell that. I could check your hormone levels in the morning and in the afternoon. If you're in perimenopause, I might catch you and they'll be different from one reading to the next. Now, what's consistent is once we hit menopause and you stop having periods, the estrogen levels and progesterone levels are low, and a couple of the brain FSH and LH, those chemicals are going to be high. So that's something that we could potentially check to see if you are truly in menopause. What are some symptoms that we experience? Everyone's pretty familiar with hot flashes and night sweats. That's what everyone classically knows as menopause. But there's other changes that can happen too. You can have insomnia, where you have trouble falling asleep, but most often with waking up throughout the night. You can have vaginal and urinary symptoms. This can be vaginal dryness, increased UTIs. You have changes in the sex drive, so sex drive can decrease, and you can have brain fog or mood changes, tiredness, fatigue, decreased metabolism. It may be harder to lose weight than it once was, which can lead to weight gain, and even joint pain can be a symptom.
Okay, so just like Dr. Teague was mentioning, hot flashes. I think a lot of us are very familiar with this idea. So like I said, we're already in Texas, but it can get hotter. It just now cooled down, and you're telling me I have to have hot flashes? So hot flashes in general, for those who are lucky enough to not be familiar, are when you have just a sudden sensation out of nowhere where you feel like it's 1,000,000 degrees in the room. Your face gets hot, gets red, you get sweaty. It can be so bad that you can forget what you were saying, what you were doing. It can just be very disorienting. Unfortunately, the exact reason why this happens, we don't know for certain. We do know it has to do with how your body responds to normal changes in temperature that is just way thrown out of whack. And importantly, it's not just a symptom you experience, it's also a sign that underneath it all, having hot flashes is a sign that you have a worse cardiovascular risk profile and a lower bone mineral density. So it is an important thing to pay attention to beyond just the symptoms of hot flashes. So like we were saying, about 80% of women will experience hot flashes during perimenopause and menopause. And the average time of having hot flashes can be for 10 years. So, and 4 to 7 years after you have the final period. So the reason that is, I think, is maybe why only 20 to 30% of women seek treatment, is because they think it's, maybe this will just last a year or two, I can deal with it until then, and then suddenly we're 7 years down the road and thinking, wow, this is really terrible. I'd really like to get some treatment for it. There are some things, we'll get into treatment really thoroughly later, but some things to look out for in the meantime. There are risk factors that we know put you at more likely to have hot flashes. That's things like smoking and having high fat and high sugar diets. Okay, so weight gain. This is another important one to talk about because it is, again, a common symptom. A lot of people think, I've been exercising the same way, I'm eating the same way, why am I all of a sudden gaining weight? And typically it's actually not necessarily a total amount of weight gain. The average weight gain is between 1 to 2.5 kilograms. However, it's more where the weight is. So suddenly the fat is just in belly fat. And you say, my pants won't button, I can't fit in the same dress, I don't understand. It's because after menopause, where fat is distributed in the body changes. It actually starts to be more around the organ fat in your belly, which is called visceral fat, and it kind of continues to grow more on the inner of the belly. So this is a little image that shows, you can see the green, and it shows that the green, so pre-menopause, the green is kind of sparse, and then as we go along, the green starts to get more and more dense, showing that fat is more concentrated around the organs after menopause. So another part that I think is worthy of specific mention is the vagina during menopause. So one thing that can happen maybe after hot flashes have stopped, a little bit further into menopause, vaginal dryness can start, and this is an extremely bothersome symptom. After estrogen stops being produced, there's decreased blood flow to the vagina and the vulva, which is the outside of the vagina, and having less blood flow means less lubrication and then a much more fragile tissue. So this can mean you can have tearing, you can have a lot of pain with sex, you can have just a general dryness that's bothersome. You also are more predisposed to frequent urinary tract infections. And so beyond those things we mentioned, again, very real health risks that come after menopause. So we'll talk more later about bone loss and osteoporosis that leads to fractures. We talked a little bit about the metabolic changes, so changes in fat distribution and weight gain. There's also changes to your cardiovascular health, so increases in your baseline blood pressure and changes to your cholesterol. So that's increases in the bad cholesterol and decreases in the good cholesterol.
So when should we see our OB-GYN? What should I be concerned about? If you have any vaginal bleeding after menopause, so if you're over a year from your last period and suddenly you have bleeding again, that is not normal and you should see a gynecologist. We'll work you up for things like uterine cancer or vaginal tears and atrophy, things that can cause bleeding, but always evaluate that. Also, of note here, if you are in that perimenopause range and your periods are a lot heavier than they used to be, or you are having bleeding between your periods, that's also not normal, especially if you're having a lot of increased pain and cramping. That could be something like fibroids or adenomyosis. There's other conditions besides just perimenopause that you could talk to your gynecologist about. Do you need to be tested for menopause? Really depends on your age and your symptoms. The vast majority of people who are having symptoms of menopause, like we talked about, don't need specific hormone testing. I can ask you what symptoms you're experiencing, and if it fits that list, it's probably going to be perimenopause. There's some routine labs that could be done, especially around age 40 to 45 if there's thoughts of other conditions that could be going on. Some other conditions can cause fatigue, like low thyroid levels. So we'll test for those, but testing your estrogen and progesterone levels probably won't tell us much more than the symptoms you're experiencing. If you're under the age of 45 and you have stopped having periods, then that would be too young to go through menopause. That's considered early menopause, so that should be evaluated by an OB-GYN as well.